Good morning. If you're over 60 and you've noticed that afternoon fog that comes around 2 or 3 o'clock, where your energy just seems to evaporate and you find yourself reaching for snacks you don't really want, or if you wake up feeling sluggish even after a full night's sleep, you're not alone. That steady energy that used to feel effortless has become something you have to think about, and sometimes you're not sure how to get it back. This is Dr. Adriana, and I want to share something simple with you today that can genuinely help steady your blood sugar throughout the day and bring back that clear, capable feeling you've been missing. Here's what I want you to know right from the start. A combination of green tea with fresh lemon juice is one of the most practical, affordable, and evidence-supported ways to stabilize your blood sugar and smooth out those energy crashes. Within the next few minutes, I'm going to tell you exactly how to prepare this combo, when to drink it, what amounts work best, and why it works so much better together than either one alone. You'll also get a clear 7-day tracking plan so you can measure the difference yourself and see exactly how this simple ritual can transform your energy and your morning clarity. Let me start by being honest about why this matters at 60 and beyond. Your metabolism has shifted in ways you can feel, but maybe haven't fully understood. The way your body handles glucose has fundamentally changed over the decades. You might be more insulin resistant now than you were 20 years ago, which means your body takes longer to move sugar out of your bloodstream. And that creates those energy crashes and that afternoon fogginess that seems to come out of nowhere. You might also find that you crave sweets more often because your blood sugar keeps spiking and crashing, and your brain is literally asking for quick energy to stabilize the dip. You reach for cookies or candy at 3 o'clock not because you lack willpower, but because your blood glucose just dropped significantly, and your body is doing what it's designed to do. This isn't a character flaw. This is your physiology signaling that it needs glucose management support. Green tea with lemon addresses both of these patterns in a way that's surprisingly effective because of what happens when you combine them, and it does this without any medications or complicated preparation. Green tea contains powerful compounds called polyphenols, and one in particular called EGCG, which is epigallocatechin gallate, if you want to know the full scientific name. This compound works in your gut and in your liver to slow down how fast glucose gets absorbed into your bloodstream. Think of it like a traffic light that tells your sugar to ease into your system rather than flooding in all at once. When glucose moves slowly, your pancreas doesn't have to flood your bloodstream with insulin all at once. Your blood sugar rises gradually, stays stable for hours, and your energy remains steady. There's no crash. There's no sudden drop that leaves you exhausted and searching for something sweet. Lemon juice, on the other hand, contains vitamin C and flavonoids that enhance your insulin sensitivity, which means your cells are more responsive to the insulin your body is making, and your glucose gets used more efficiently by your muscles and brain. When you drink them together, you get a two-part action. One component slows the arrival of sugar, and the other helps your cells use that sugar more effectively. That synergy is what makes this combination so much more powerful than either component alone. It's like having two different workers on the same job, making sure nothing gets backed up or overwhelming. One prevents the rush of glucose entering your system, and the other improves your body's ability to handle what does arrive. Now, let me give you realistic expectations about what you can expect to experience. Most people who add this daily ritual notice steadier energy and fewer afternoon crashes within 7 to 14 days. Some people feel the difference sooner, especially if they're sensitive to blood sugar fluctuations or if they were previously experiencing severe afternoon crashes. You might notice that you don't reach for your 3 o'clock snack anymore, or that when you do eat an afternoon snack, you actually feel satisfied by a normal portion instead of wanting more and more. You might find that your morning mental fog lifts after just a few days. Some people report sleeping better because their blood sugar is more stable, which improves sleep quality significantly. But this is not a miracle cure. This is evidence-informed support that works best when combined with regular meals that include protein and fiber, regular movement, good sleep, and stress management. It's a ritual that builds on those foundations, not a replacement for them. Think of it as one powerful piece of a bigger puzzle. Here's exactly how to prepare green tea with lemon, and I want you to write this down or bookmark this video so you can reference it whenever you need to. Use 1 organic green tea bag, or 2 grams of loose leaf green tea. If you're thinking about whether to use loose leaf or bags, loose leaf tends to have slightly more intact polyphenols because the leaves aren't as broken down during processing, but a good quality green tea bag works beautifully and is often more convenient. The water temperature is absolutely important, and this is worth paying attention to. You want water that's between 160 and 180 degrees Fahrenheit. If you don't have a thermometer, that means you'll boil the water and then let it cool for about 3 to 5 minutes before you pour it over the tea. Boiling water destroys the delicate polyphenols in green tea, so this step genuinely matters for getting the full benefit. The difference between water at the right temperature and boiling water is the difference between getting 90% of the benefit or getting only 40%. This isn't an exaggeration. The heat sensitivity of polyphenols is real and measurable in laboratory studies. Pour the hot water over your tea and let it steep for 3 to 5 minutes. 3 minutes gives you a lighter brew with smooth flavor and a bit less caffeine. 5 minutes gives you a stronger brew with more of the beneficial compounds extracted, but also slightly more caffeine and a stronger taste. Start with 4 minutes and adjust from there based on how you like the taste. While your tea is steeping, squeeze the juice of half a fresh lemon into your cup. Fresh is important because bottled lemon juice loses some of its vitamin C content over time and loses some of the flavor compounds that matter. If you like a stronger lemon flavor, use 3/4 of a lemon or even a whole lemon. If you prefer something milder, use 1/4 of a lemon and build from there as you get used to the taste. The lemon should taste bright and present, adding to the tea rather than overwhelming it. When your tea is finished steeping, remove the tea bag or strain the loose leaves carefully, then pour the hot tea into your cup with the lemon juice. Stir it gently, let it cool just slightly if it's too hot to sip comfortably, and drink it slowly over the next 10 to 15 minutes. This slower pace allows your digestive system to process the compounds effectively. This is not a tea you want to rush through. Some people like to add a small amount of honey or stevia if they want just a hint of sweetness, and I want to be clear about this. Adding honey does add a small amount of glucose, so it will have a minor effect on the blood sugar benefit of the combination. If you're adding it, use less than 1 teaspoon and stir it in after the tea cools just slightly so the heat doesn't damage the nutrients in the honey or reduce its benefits. Stevia, on the other hand, is a non-caloric sweetener that won't affect your blood sugar at all, so that's a good option if you want sweetness without the glucose impact. Some people find they don't need any sweetener after a week or 2 as their taste adjusts. Now, when should you drink this combination? The best time for most people is in the morning, within the first hour after you wake up. This primes your metabolism for the entire day and sets your blood sugar on a steadier trajectory from the beginning. If you usually have breakfast, you can drink your green tea with lemon about 15 minutes before you eat, which allows the polyphenols to be present in your system as you digest your meal. This timing is actually strategic. This is when it does its most important work of slowing down glucose absorption. The compounds are there and ready when your digestive system starts processing your food. For some people, drinking this tea in the afternoon around 2 or 3 o'clock provides an excellent energy support and helps prevent that late afternoon crash. If you're sensitive to caffeine or if it affects your sleep, afternoon tea should be consumed before 3 o'clock, so you have at least 4 to 5 hours before bedtime. Green tea contains about 30 to 50 milligrams of caffeine per cup, which is considerably less than coffee, which has about 90 to 100 milligrams, but still enough to matter if you're sensitive to caffeine or if you have sleep issues. If you want to drink this combination in the evening or later in the afternoon, I'll tell you about caffeine-free options in just a moment. Making this a daily ritual is about convenience and consistency. Here's what works well. Brew a larger batch on Sunday evening or Monday morning, enough for 4 or 5 days. Pour it into a glass pitcher and store it in the refrigerator. Each morning, pour a cup into your thermos or regular mug and add fresh lemon juice. Refrigerated green tea stays fresh for about 3 to 5 days, so you won't run out. Some people enjoy it chilled right from the fridge, and some like to warm it up gently in a microwave or on the stovetop. Both approaches work equally well for your blood sugar benefit. If you're at work or out during the day, a small thermos keeps it at a good temperature for hours. This batch method also means you're more likely to stay consistent because you have it ready to go. If you prefer, you can also brew individual cups each morning, which takes only 5 to 7 minutes, and gives you that warm ritual many people find calming and grounding at the start of their day. The ritual itself becomes valuable because it signals to your body that you're taking care of it. That intentional moment of self-care, that few minutes you spend preparing and sipping your tea, genuinely matters for your well-being and your commitment to yourself. Let me address something important now, because I want you to use this safely and effectively. There's a common mistake that reduces the benefit significantly. People sometimes use boiling water directly from the kettle. This makes the tea taste bitter and astringent, and actually destroys many of the polyphenols you're trying to get. The same thing happens if you steep the tea for too long, say 10 or 15 minutes. You get a harsh, unpleasant taste and actually end up with fewer beneficial compounds. Another mistake is skipping the lemon or using very little lemon because you're worried about the taste or the acidity. But the lemon is half of the synergy. The citrus compounds genuinely enhance how your body handles glucose. Without it, you lose much of the benefit. So use the full amount of lemon juice. Your taste buds will adjust within a few days, and you'll find it's actually quite pleasant and refreshing. The third mistake some people make is adding so much honey or other sweeteners that they essentially cancel out the blood sugar stabilizing benefits. Remember, if you want sweetness, use just a touch of honey or try stevia, which gives you the sweetness without affecting your blood glucose. The fourth common mistake is inconsistency. Drinking this 4 times a week or sporadically won't give you the results that drinking it daily will give you. Your body needs consistency to build new patterns and to respond to these compounds. Now, I know that green tea with lemon isn't right for everyone, and I want to talk carefully about who needs to modify or choose a different option. If you're taking blood thinners or anticoagulant medications like warfarin or other similar drugs, green tea contains vitamin K, which can interact with these medications and affect how they work. You're not prohibited from drinking it, but you need to drink it consistently every day rather than skipping days, because vitamin K needs to be consistent for blood thinners to work properly. You should let your doctor know you're adding it to your routine. They may want to monitor your blood clotting levels more frequently. This is a conversation to have with your doctor, not a reason to avoid the tea. If you have kidney disease or you've been told to limit your fluid or electrolyte intake, the caffeine in green tea may not be appropriate for you, and you should check with your nephrologist before starting. If you have gastroesophageal reflux disease, GERD, the acid in lemon juice and the tannins in tea can trigger heartburn or reflux, especially if you drink it on an empty stomach. If this is you, we'll talk about modifications in just a moment. If you have iron deficiency anemia, you should know that the tannins in tea can reduce your ability to absorb iron from food and supplements. If you're treating iron deficiency, drink your green tea at least 2 hours away from iron supplements or iron-rich meals. If you're sensitive to caffeine, if you experience heart palpitations or sleep disruption easily, green tea may be too much caffeine even at these smaller amounts. If you have a bleeding disorder or if you have very easy bruising, let your doctor know before adding green tea to your routine. If you're pregnant or breastfeeding, high amounts of green tea aren't recommended because of the caffeine and because compounds in green tea do pass into breast milk. If you're diabetic and you're on medications like metformin, insulin, sulfonylureas, or GLP-1 medications, this is not a reason to avoid the tea combo, but it does mean you should monitor your blood sugar response closely and talk with your clinician about whether your medication timing or dosing needs adjustment, because you may need less medication once your blood sugar becomes more stable. This is actually a positive thing and worth celebrating, but it needs to be managed with your doctor's guidance. For people who want the blood sugar benefits but need to avoid or modify, here are your solid options. If you need a caffeine-free choice for evening, or if you're sensitive to caffeine, try rooibos tea with lemon. Rooibos is a naturally caffeine-free herbal tea from South Africa that contains polyphenols and has been shown in some studies to support glucose metabolism similarly to green tea. Brew it at 170 to 180 degrees for about 4 to 5 minutes. Add the same amount of lemon juice as you would with green tea, and it gives you the same synergistic benefit without caffeine. Another option is chamomile tea with lemon or lime. Chamomile is naturally calming, completely caffeine-free, and pairs beautifully with citrus. Brew it at 170 to 180 degrees for 4 to 5 minutes and add fresh citrus juice. Some people even combine chamomile with a small amount of rooibos to get more polyphenol content while keeping it caffeine-free. If you specifically want the green tea polyphenols but need less caffeine, decaffeinated green tea is an option worth exploring. The decaffeination process removes most, but not all of the caffeine, reducing it to about 5 to 10 milligrams per cup compared to 30 to 50 in regular green tea. Some polyphenols are also slightly reduced during decaffeination, but you still get substantial benefits. Brew it exactly like regular green tea and add your lemon juice. If you have GERD and you want to try this combination, use a smaller amount of lemon, perhaps a quarter of a lemon or 1 tablespoon of lemon juice instead of half a lemon. Drink it with food or after eating rather than on a completely empty stomach. Skip the honey or any other additions if they typically trigger reflux for you. Some people with GERD find that diluting the tea slightly, using a bit more water, makes it easier to tolerate. You can also substitute lime for lemon since some people tolerate it better, or use a milder herbal tea like white tea with just a small squeeze of lemon. If you don't like the taste of lemon or if you have a citrus allergy, you have other options to explore. Orange juice has similar compounds to lemon and creates a sweeter, milder flavor with green tea. Use 2 tablespoons of fresh orange juice or the juice of a quarter of an orange instead of lemon juice. Lime is another excellent choice, slightly more tart than lemon, but with a beautiful flavor. Use the juice of half a lime. If you have an allergy to citrus, you lose some of the synergistic benefit, but you can experiment with other polyphenol sources. A small amount of fresh ginger juice added to green tea, for example, adds anti-inflammatory compounds that also support metabolic health. 1 tablespoon of freshly grated ginger steeped with the tea can work if you like that flavor profile. Now let's talk about how to measure whether this is actually working for you, because the best proof is your own experience and your own data. I want you to create a simple 7-day tracking plan. Each morning for the next 7 days, before you add this tea and lemon combo to your routine, rate your energy stability on a scale of 1 to 5. 1 means your energy is crashing and unstable throughout the day. You feel tired by mid-morning and you need snacks to keep going. 5 means your energy is steady and reliable from morning through evening. You don't feel those energy dips and you feel capable and alert. Rate your morning alertness and clarity the same way. 1 means you wake up foggy and confused and it takes hours to feel clear enough to focus or make decisions. 5 means you wake up with mental clarity and you feel ready to move through your day with focus and purpose. Also note whether you experience an afternoon crash, and if you do, rate the severity of it from 1 to 5. If you monitor your blood sugar at home, you can take readings before you drink your green tea and lemon, and then again 30 to 45 minutes after. Note what time of day you're testing and what you ate. This gives you real data about how your blood sugar is responding to the tea combo. If you don't monitor blood sugar at home, you can simply observe your energy, whether you find yourself reaching for snacks around 3 or 4 in the afternoon, and whether your cravings for sweet foods change. Track your hunger and satiety. Do you feel satisfied after meals, or do you feel hungry again within an hour? Do you have fewer cravings for sweets? Finally, track your compliance. How many servings of green tea with lemon did you actually drink this week? If you drank it 5 days, that's great. If you drank it 7 days, even better. Consistency matters more than perfection. Do this same tracking from day 1 through day 7. On day 7, compare your energy stability rating from day 1 to day 7. Compare your morning clarity. Look at whether afternoon crashes decreased and by how much. Look at your hunger and satiety patterns. Most people notice a difference by day 5 or day 6, and the difference is usually clearer by day 7. Some people see a shift even sooner, within the first 2 or 3 days, especially if they were previously experiencing severe afternoon crashes. If by day 3 or day 4 you're not noticing any improvement, consider adjusting. Maybe your tea is steeping too long or your water is too hot, which would destroy the polyphenols. Maybe you're adding too much honey or sweetener. Maybe you're skipping the lemon some days. Or maybe you need to shift the timing. If you're drinking it in the afternoon only, try drinking it in the morning instead. If morning energy is still sluggish, consider that you might benefit from combining this tea with a protein-based breakfast rather than drinking it alone. I want you to share your results in the comments section. Write day 1, and then your numbers for energy, morning clarity, and crash severity. Write day 7 and your updated numbers. This is how we build community and help each other. Someone else watching might be on their day 1 today, and they'll see that you went from a 2 to a 4 on energy stability, and they'll feel hopeful that this can work for them too. Your honest tracking and your willingness to share it actually creates real value for others watching this channel. This community aspect is real and powerful. Before we finish, let me make sure you're clear on the safety part. Everything I'm sharing with you is educational information, not medical advice. It's based on clinical evidence and what I've seen work for patients and people watching this channel. But it's not a substitute for consultation with your own doctor or healthcare provider. If you have any health conditions, if you're on medications, especially blood thinners, diabetes medications, or anything related to iron absorption or kidney function, please run this by your clinician before you start. Show them this video if it helps clarify what you're planning to do. Watch for signals that you should stop or talk to your doctor. If you experience unusual swings in your blood sugar after adding this combo, tell your clinician. If you notice unusual bruising or bleeding, especially if you're on anticoagulants, that's a signal to check in with your doctor immediately. If you develop heartburn or stomach upset that doesn't resolve in a few days, you may need to modify the amount of lemon or switch to one of the alternatives I mentioned. If your sleep gets worse instead of better, reduce the afternoon dose or switch to a caffeine-free option. If you notice heart palpitations or an unusual heartbeat, stop the tea and contact your healthcare provider right away. Here's what I want you to remember about why this works and how to use it consistently. Green tea with lemon is a proven, practical, affordable way to support steadier blood sugar and smoother energy throughout your day. You brew 1 green tea bag or 2 grams of loose leaf tea in water that's 160 to 180 degrees for 3 to 5 minutes. You add the juice of half a fresh lemon. You drink it in the morning within an hour of waking or with your breakfast, and you can also have it in the afternoon before 3 o'clock if you want that energy support. You can make a batch at the beginning of the week and store it in the refrigerator, or you can brew fresh each morning. Either way, works beautifully. You add just a touch of honey or stevia if you want sweetness, or you skip it altogether. If green tea and lemon aren't right for you because of medications or conditions, you have solid alternatives. Rooibos with lemon, chamomile with lemon, or decaffeinated green tea with lemon all work similarly. You track your results for 7 days, so you have real data about whether your energy is steadier, whether afternoon crashes decreased, and whether morning clarity improved. If you're diabetic or on blood thinners, you let your doctor know and you monitor how your body responds. If you have GERD or caffeine sensitivity, you modify the amounts and timing as I described. You make this a daily ritual because consistency is what creates the benefit. It's not something you do once and expect a benefit. It's something you do every morning. And within 1 to 2 weeks, most people notice they feel clearer. Their energy is more stable. Their afternoon fog lifts, and they're not fighting sugar crashes anymore. This is the kind of sustainable, simple change that actually sticks because it works. This isn't a cure. This is one piece of a comprehensive approach to your metabolic health. This works best alongside regular movement, protein and fiber at meals, good sleep, and managing your stress. If you have diabetes or blood sugar concerns, this complements your medications and your doctor's care. It doesn't replace them. But what it does is give you one very concrete, practical, affordable thing you can do every single morning that genuinely supports your bodies to manage blood sugar naturally and keep your energy steady. You're taking an active role in your health, and that matters tremendously. I'm Dr. Adriana with Senior Health, and if this information is helpful to you, please subscribe to the channel. This is a space where we focus on practical, evidence-informed wellness strategies designed specifically for people over 60. We respect your experience, your intelligence, and your desire to feel capable and clear in this stage of your life. You've worked hard to get where you are, and you deserve to feel steady, energized, and present every single day. This simple tea and lemon ritual is one powerful way to do that. Start today. Brew your first cup tomorrow morning. Track your results with honesty and care. Share them in the comments and inspire others. Let me know how you feel by day 7, and remember, this is just the beginning of what consistent, informed self-care can do for your energy, your clarity, and your overall well-being.